Hello, everyone, and welcome to today's presentation. I'm excited to have you here as we explore the fascinating topic of control and regulation of ventilation and cerebral blood flow. The title of our talk is Control and Regulation of Ventilation and Cerebral Blood Flow, with a focus on mechanisms, reflexes, and their clinical implications in respiratory and brain function. Over the next few slides, we'll delve into how our bodies manage these vital processes, the reflexes involved, and what it means for clinical practice. Let's get started. On this slide, we're looking at how ventilation and cerebral blood flow are controlled within the body. Ventilation, or the process of breathing, is primarily regulated by specific centers in the brain known as the respiratory centers. These centers are located in the medulla oblongata and the pons, which work together to manage both the rate and the depth of our breathing. What's really interesting is how our body constantly monitors chemical levels through specialized receptors. These receptors keep track of carbon dioxide, oxygen, and the pH level in the blood, and based on that information, they help adjust ventilation accordingly. This is a fine-tuned feedback system that ensures our breathing matches our body's needs. While most control of breathing is automatic, we do have some voluntary influence over it, like when we hold our breath or take deep breaths consciously. However, this voluntary control is limited compared to the automatic regulation managed by the brainstem. It's also important to recognize that when the control mechanisms for ventilation are disrupted, it can lead to various respiratory disorders. These issues can significantly impact oxygen delivery to tissues and overall health. Understanding this regulatory system is a key part of the broader theme of how our body maintains homeostasis and protects vital functions like brain perfusion and respiration. Let's talk about the control and regulation of ventilation and cerebral blood flow. Just like a heartbeat, breathing happens automatically, meaning it doesn't require our conscious effort. It's an involuntary process that keeps us alive without us even thinking about it. However, unlike the heartbeat, breathing has a unique feature. We can consciously change our breathing patterns if we choose to. For example, we can hold our breath or take deep breaths intentionally. This ability to control ventilation consciously is important because it allows us to influence how much air we breathe in and out, which in turn affects cerebral blood flow and overall brain function. So, while breathing is automatic, we also have a degree of control over it, linking it directly to our overall regulation of brain health and activity. Let's take a closer look at how ventilation and cerebral blood flow are controlled and regulated. At the core of this process is the medullary respiratory center, which is responsible for generating the rhythmic impulses that drive our breathing. These impulses originate from specific groups of neurons located in the brainstem, specifically in the medulla oblongata and the pons. One of the key groups is the dorsal respiratory group, or DRG. This group plays a crucial role in generating the basic respiratory rhythm, essentially setting the pace for our breathing cycles. It's like the conductor of the respiratory orchestra, ensuring everything stays in sync. Then we have the ventral respiratory group, or VRG, which also contributes to ventilation, especially during more forceful breathing or increased demand, like during exercise. Alongside these, there's the pneumataxic center in the pons, which influences the pattern of breathing, helping to fine-tune the rhythm and depth of each breath. Connecting this back to the overall theme, these neural groups work together seamlessly to regulate ventilation according to the body's needs, ensuring that cerebral blood flow remains stable and adequate. This intricate control highlights just how finely tuned our respiratory system truly is. Let's delve into how the control and regulation of ventilation and cerebral blood flow work, starting with the medullary respiratory center. This is the key area in the brainstem responsible for generating the rhythmic impulses that control our breathing. These impulses are essential because they set the pace of ventilation, ensuring our body gets enough oxygen and removes carbon dioxide effectively. Now, these rhythmic impulses originate from specific groups of neurons. These neurons are strategically located in the medulla oblongata and the pons, which are parts of the brainstem. Their coordinated activity creates the breathing rhythm that we don't even have to think about most of the time. Focusing on the medulla, one of the main groups involved is the dorsal respiratory group, or DRG. The DRG is crucial because it helps generate the basic rhythm of breathing. It acts as a sort of pacemaker, sending signals that tell the diaphragm and other respiratory muscles when to contract. Then there are other important players, like the ventral respiratory group, or VRG. The VRG also contributes to ventilation, especially during increased breathing demands, like exercise or stress. It works alongside the DRG to fine-tune our breathing pattern. Additionally, we can't forget the pneumataxic center, which is located in the pons. This center influences the respiratory pattern by regulating the duration and rate of breaths. It essentially acts as a modulator, helping to smooth out our breathing rhythm and prevent overbreathing. All these groups work together seamlessly to regulate our ventilation, which is vital for maintaining proper cerebral blood flow and overall homeostasis. Their coordination ensures that our brain and body receive just the right amount of oxygen and that carbon dioxide levels stay balanced. Let's take a closer look at how ventilation and cerebral blood flow are controlled and regulated. This process primarily occurs in the medulla, specifically in an area known as the nucleus of the tractus solitarius. This region plays a crucial role in sensing and integrating signals related to blood gases and blood pressure. Most of the neurons here are inspiratory neurons, which are responsible for initiating the inhalation process, ensuring that we get enough oxygen. Moving on, we also have the dorsal respiratory group, or DRG, which is located bilaterally in the anterior and lateral parts of the medulla. The DRG mainly contains expiratory neurons, and it helps regulate the rhythm and depth of breathing by controlling the muscles involved in expiration. Then there's the ventral respiratory group, or VRG, which works alongside the DRG but has a slightly different role. It contains both inspiratory and expiratory neurons and is more active during increased respiratory demand, like during exercise or stress. Together, these groups coordinate to ensure our breathing is smoothly regulated, responding to changes in oxygen and carbon dioxide levels, and ultimately supporting the overall theme of maintaining homeostasis in our body's vital functions. Now, let's take a closer look at how ventilation and cerebral blood flow are controlled and regulated. This process primarily involves structures located in the pons, a critical area in the brainstem. The neurons here play a key role in controlling the off-switch point of the dorsal respiratory group's inspiratory ramp signal, which essentially helps regulate the transition from inspiration to expiration. The main function of this control center is to determine the length of each inspiration, ensuring that our breathing pattern remains steady and appropriate for the body's needs. One of the most important components within this regulation system is the pneumataxic center. Located in the pons as well, it fine-tunes our breathing by controlling how long and how intense each inspiration is. This becomes particularly relevant in certain conditions, such as in patients with severe brain injuries. These individuals may experience prolonged gasping breaths that are interrupted by brief expirations, a pattern known as apneusis breathing. This abnormal breathing pattern highlights how delicate and finely balanced the regulation of respiration truly is. Another key structure is the apneustic center, which also resides in the pons. It plays a crucial role in modulating the depth of inspiration, especially during irregular breathing patterns. Together, these centers coordinate to ensure our breathing remains smooth, effective, and responsive to our body's needs, linking directly to the overall theme of how our brain controls vital functions like respiration and blood flow. Let's talk about the control and regulation of ventilation and cerebral blood flow. First, the central ventilatory drive, which is the main engine behind our breathing, originates from the medulla in the brainstem. This is the core area that initiates and regulates our breathing pattern. However, it's not acting alone. It's influenced by a variety of inputs from peripheral sensors located throughout the body. These sensors constantly monitor things like oxygen and carbon dioxide levels, as well as other physiological parameters. Specifically, peripheral sensors are found in the lungs, muscles, and joints. They play a crucial role by detecting changes in the environment and sending signals back to the central control centers. These signals help modify the central ventilatory drive, ensuring our breathing adjusts appropriately to different activities or conditions. Finally, reflex control of breathing is an important aspect of this system. Reflexes are automatic responses that help us respond quickly to changes, such as holding our breath or adjusting our breathing when we experience sudden hypoxia or hypercapnia. Altogether, this integrated system of central and peripheral controls, along with reflexes, ensures that ventilation is finely tuned to meet the body's needs, safeguarding both oxygen delivery and cerebral blood flow. Let's now discuss the control and regulation of ventilation and cerebral blood flow, starting with reflex control of breathing. This mechanism is crucial because it helps maintain proper breathing patterns, especially when our physical activity levels change. For example, as you start to exercise, your body needs more oxygen and needs to get rid of carbon dioxide more efficiently. The reflex system ensures that your breathing adjusts accordingly without you having to think about it consciously. During exercise, regulation becomes even more important. The body increases both the rate and depth of breathing to meet the higher demands for oxygen. Interestingly, this regulation kicks in only when tidal volumes reach a certain threshold, specifically when they are about 800 to 1,000 milliliters or more. This means that small changes in breathing don't trigger these responses, but larger, more forceful breaths do. Now, let's talk about stretch receptors, which are key players in preventing overinflation of the lungs. When the lungs are stretched during deep inhalation, these receptors send signals via the vagus nerve to inhibit further inspiration. Essentially, they tell your brain to stop inhaling because your lungs are already sufficiently inflated, helping to protect against overexpansion. This brings us to the Höring-Brewer inflation reflex. These stretch receptors are located in the smooth muscle of both large and small airways. When they detect excessive stretching of the lungs, they trigger this reflex. It's a protective mechanism that helps regulate the depth of breathing and maintain a healthy balance, important for ensuring that ventilation remains efficient and safe during various activities. All these reflexes work together seamlessly to coordinate our breathing, especially during physical exertion, ensuring that our brain and muscles get the oxygen they need while preventing lung overinflation. Let's talk about how the control and regulation of ventilation and cerebral blood flow work, starting with reflex control of breathing. When there are diseases characterized by low lung compliance, such as those involving strong elastic retraction forces, the body responds by stimulating the inflation stretch receptors. This happens because increased mechanical stress is applied to the airways during inspiration, which activates these receptors. One key reflex involved here is the Höring-Brewer inflation reflex. When these stretch receptors are stimulated, they actually shorten the inspiratory phase of breathing. As a result, this reflex causes an increase in the respiratory rate. This mechanism plays an important role in shaping breathing patterns, especially in pathological conditions. It helps prevent overinflation of the lungs and maintains efficient ventilation. So, understanding these reflexes and their impact on breathing helps us see how the body adapts to various challenges and maintains proper blood flow and oxygenation to the brain and other vital organs. Let's take a closer look at how the control and regulation of ventilation and cerebral blood flow work, starting with the reflex control of breathing. This reflex is crucial because it helps us maintain a stable and adaptive breathing pattern, especially when there are sudden changes in lung volume. For example, if your lungs suddenly stretch too much or too little, this reflex kicks in to adjust your breathing accordingly. Now, one key aspect of this is hyperpnea activation. When this happens, you'll notice that the patient may start to breathe more deeply or rapidly, what we call hyperpnea. This increased effort is the body's way of responding to certain stimuli or needs, ensuring oxygen delivery and carbon dioxide removal are balanced. Another important point is what happens during accidental forced deflation of the lungs, such as when the lung is deflated below the residual volume level. This triggers a reflex response aimed at protecting the lungs and maintaining proper ventilation. Specifically, the Hering-Brewer deflation reflex comes into play during events like a sudden lung collapse, for instance, a pneumothorax. When the lung collapses abruptly, this reflex stimulates strong inspiratory efforts, essentially telling the body to breathe more deeply and quickly in response to the lung's collapse. As a result, we see an increase in the respiratory rate to compensate for the reduced lung volume. Overall, these reflexes work together to ensure our breathing stays efficient and responsive, even when faced with sudden changes or challenges, maintaining adequate cerebral blood flow and overall homeostasis. Let's take a closer look at the reflex control of breathing, focusing on what's known as the head's paradoxical reflex. This reflex plays a fascinating role in how we regulate our breathing, especially in certain situations. One key point is its significance in newborns. It may actually be involved in triggering those very first breaths when a baby is born, helping to initiate breathing right after delivery. Another important aspect is its role in preventing alveolar collapse, also called atelectasis. You might notice that during quiet breathing, we often take deep sighs, and this reflex is thought to be responsible for those. Those sighs help keep the alveoli open and functioning properly. Additionally, this reflex might be crucial during exercise. It could help us maintain larger tidal volumes, so we can breathe deeply and efficiently when we're physically active. Now about the mechanism itself. The head's paradoxical reflex is interesting because it involves a situation where, if the Hering-Brewer reflex is partially blocked, say, by cooling the vagus nerve, lung hyperinflation can actually lead to further inspiratory effort. In other words, instead of stopping us from inhaling more, the system can become a bit paradoxical, encouraging deeper breaths. All of these points highlight how complex and finely tuned our respiratory control system really is, especially in maintaining proper ventilation and cerebral blood flow. Now, let's delve into how the control and regulation of ventilation and cerebral blood flow are managed through reflexes. When we talk about the reflex control of breathing, we're referring to how our body automatically responds to certain stimuli to protect our airways and maintain proper breathing. For example, stimulation of specific receptors triggers reflexes that help clear the airways or adjust our breathing pattern as needed. A key player here are the irritant receptors, which are located in the epithelium of the larger conducting airways. These receptors respond to various physical actions like suctioning, intubation, or bronchoscopy, things that involve direct physical manipulation of the airways. They also react to inhaled irritants such as smoke, cold air, or toxic gases. When these irritant receptors are stimulated, they initiate several protective responses. These include reflex bronchoconstriction, which narrows the airways, coughing and sneezing to expel irritants, and an increase in breathing rate, known as tachypnea. Sometimes, stimulation can even cause a narrowing of the glottis, which helps prevent entry of harmful substances. Interestingly, stimulation of these receptors can also trigger a vasovagal response, resulting in bradycardia, or a slowing of the heart rate. This illustrates how interconnected our respiratory and cardiovascular reflexes are. Overall, these irritant receptors play a critical role in safeguarding our respiratory system by detecting harmful stimuli and activating reflex responses to protect us from potential harm. Let's discuss the control and regulation of ventilation and cerebral blood flow, focusing now on the reflex control of breathing and its clinical relevance. Understanding the function of J receptors is crucial because they play a significant role in conditions such as pneumonia, congestive heart failure, and pulmonary edema. These receptors are key players in the reflex mechanisms that regulate our breathing. J receptors respond to specific pulmonary conditions, acting as sensors for certain changes within the lungs. When stimulated, they can cause rapid, shallow breathing, which is often seen in respiratory distress. You might also notice a sensation of dyspnea, or shortness of breath, which is a common symptom in many pulmonary issues. Additionally, Stimulation of these receptors can lead to narrowing of the glottis, affecting airflow. So, what exactly stimulates these J receptors? They are activated by alveolar inflammation, such as in pneumonia, or by pulmonary vascular congestion, which occurs in conditions like CHF and pulmonary edema. These receptors are located in the C fibers within the lung parenchyma, situated near the pulmonary capillaries. This strategic location allows them to detect changes in the blood flow and the state of the alveoli. Understanding how J receptors function and respond helps us better manage and treat respiratory conditions by targeting the reflex pathways that influence breathing patterns and sensations. This integration of reflex control mechanisms is essential for maintaining proper ventilation and cerebral blood flow under various physiological and pathological states. Let's now discuss how the control and regulation of ventilation and cerebral blood flow operate, focusing on reflex control of breathing. This reflex mechanism is crucial because it helps adapt our breathing to various stimuli and situations. For example, painful stimuli or physical movement can actually stimulate ventilation, which can help counteract respiratory depression. This is particularly important in clinical settings where respiratory depression is a concern. Moving on to the role of exercise, peripheral proprioceptors, those sensory receptors located in muscles, tendons, and joints, play a vital part. They help initiate and sustain increased ventilation right at the start of exercise, ensuring our body gets enough oxygen during physical activity. Another interesting point is the effect of cold water. Splashing cold water on the skin can stimulate ventilation as well, highlighting how external stimuli can influence our breathing patterns. In addition, various stimuli like moving limbs, slapping the skin, or other painful sensations can enhance ventilation, especially in patients experiencing respiratory depression. These stimuli send impulses to the brain's medulla, which then increases inspiratory activity, leading to hyperpnea, more vigorous breathing. Finally, these peripheral proprioceptors are located in muscles, tendons, joints, and pain receptors in muscles and skin. They send critical signals that help regulate our breathing in response to physical activity or external stimuli, ensuring our cerebral blood flow remains well regulated during different states of activity or stress. Let's take a closer look at how the control and regulation of ventilation and cerebral blood flow work, starting with reflex control of breathing. This mechanism helps our body respond automatically to various stimuli, ensuring that our breathing remains efficient and balanced. One key aspect here is adaptation to increased load. When our muscles, particularly those involved in breathing like the diaphragm and intercostal muscles, face a greater demand, say during exercise, they need to adjust quickly to handle the extra workload. This adaptation involves reflexes that trigger muscle responses. When these muscles are stimulated, they contract with greater force, which helps us meet the increased oxygen demand and remove carbon dioxide more effectively. Now, these muscles are part of a reflex arc, a neural pathway that links the stimulus to the response, making the process automatic and rapid. You'll find muscle spindles located in the diaphragm and intercostal muscles. These sensory receptors play a crucial role because they detect stretch or changes in muscle length, sending signals to the nervous system to adjust muscle activity accordingly. So, to sum up, this reflex control mechanism is vital for maintaining proper ventilation, especially when our body's load increases. It ensures that our breathing adapts seamlessly, supporting overall cerebral blood flow and brain function during different activity levels. Now, let's explore how ventilation and cerebral blood flow are controlled and regulated. First, the body works hard to keep the right balance of oxygen, carbon dioxide, and hydrogen ions in the blood by adjusting ventilation accordingly. This process relies on substances in the blood that signal when adjustments are needed, helping us maintain homeostasis. Central to this regulation are chemoreceptors, which send impulses to the medulla to increase ventilation when necessary. Central chemoreceptors, in particular, monitor the blood's chemistry, especially the levels of carbon dioxide and hydrogen ions, and respond accordingly. Then we have peripheral chemoreceptors, which mainly keep an eye on blood oxygen levels and contribute to ventilation regulation by detecting drops in oxygen. All of this chemical control ensures that our breathing adapts in real time, maintaining the proper environment for our brain and body's function. It's a finely tuned system that connects blood chemistry to our breathing, highlighting how closely our respiratory and nervous systems work together to keep us healthy. Let's look at how the control and regulation of ventilation and cerebral blood flow are managed, starting with the role of central chemoreceptors. These specialized sensors are crucial because they help us regulate breathing based on the chemical environment of the brain. When blood CO2 levels increase, this causes a rise in the H+ concentration in the cerebrospinal fluid, or CSF. This is important because increased blood CO2 crosses the blood-brain barrier quite easily, unlike some other substances. However, it's key to note that these chemoreceptors are not in direct contact with the arterial blood itself. Instead, they are influenced by the chemicals present in the CSF, which reflect the blood's chemical status indirectly. The location of these central chemoreceptors is embedded within the medulla, a vital part of the brainstem. Their strategic position allows them to monitor the chemical changes in the CSF and, in turn, regulate ventilation to maintain proper cerebral blood flow and overall homeostasis. So, in essence, these chemoreceptors serve as a critical link between blood chemistry and respiratory control, ensuring that our brain receives an adequate blood supply and that the internal environment remains stable. Now, let's take a closer look at how the control and regulation of ventilation and cerebral blood flow work, starting with the role of central chemoreceptors. These specialized receptors are highly sensitive to changes in the chemical environment of the brain. The key chemical reaction involved here is the conversion of carbon dioxide and water into hydrogen ions and bicarbonate. Specifically, CO2 reacts with H2O to form H+ and HCO3. This reaction is crucial because it links CO2 levels directly to the acidity of the cerebrospinal fluid. So, what do central chemoreceptors do with this information? They respond primarily to increases in H+ ions, which, as you now know, are a direct result of rising CO2 levels. When CO2 increases in the blood or cerebrospinal fluid, it causes a rise in H+ concentration. The chemoreceptors detect this change and become activated. Once they sense elevated H+ levels, the central chemoreceptors send signals to the medulla, which is the control center for breathing. If the CO2 levels are high, the signal is to increase ventilation, that is, to breathe more rapidly and deeply. This helps to expel excess CO2 and restore the chemical balance. In essence, this feedback loop ensures that our ventilation adjusts dynamically to maintain stable CO2 levels, supporting both cerebral blood flow and overall homeostasis. It's a fine example of how our nervous and chemical systems work together seamlessly to keep us healthy. Let's talk about how ventilation and cerebral blood flow are controlled and regulated, focusing on central chemoreceptors. First, it's important to understand that the stimulatory effect of CO2 on these chemoreceptors doesn't stay the same over time. In fact, it gradually declines over about 1 to 2 days. So, initially, CO2 strongly stimulates these receptors, but this effect diminishes with sustained exposure. Now, central chemoreceptors are primarily influenced by the partial pressure of CO2 in arterial blood, or PaCO2. This means that ventilation is largely mediated through these receptors, which respond directly to changes in CO2 levels. When PaCO2 increases, the chemoreceptors signal the brain to increase ventilation. Speaking of PaCO2, it plays a crucial role in controlling ventilation on a very short-term basis, minute to minute. Essentially, PaCO2 acts as the primary stimulus for adjusting our breathing rate and depth to maintain homeostasis. And here's a key point. For every 1 mmHg rise in PaCO2, alveolar ventilation can increase by about 2 to 3 liters per minute. That means even small changes in CO2 levels can lead to significant adjustments in how we breathe, ensuring that CO2 is kept within a narrow, healthy range. Overall, understanding this dynamic helps us see how tightly our body regulates cerebral blood flow and ventilation, especially in response to changing CO2 levels, maintaining our brain's environment stable and optimal. Let's take a closer look at how ventilation and cerebral blood flow are controlled and regulated, starting with the peripheral chemoreceptors. These are small but highly vascular tissues that play a crucial role in monitoring blood chemistry. They are located at two main sites, the carotid bodies and the aortic bodies. The aortic bodies are situated near the arch of the aorta, which is a key blood vessel leaving the heart. Meanwhile, the carotid bodies are found at the bifurcation of the common carotid artery, where it splits into the internal and external branches. These peripheral chemoreceptors are vital because they detect changes in blood oxygen, carbon dioxide, and pH levels. When they sense a decrease in oxygen or an increase in carbon dioxide or acidity, they send signals to adjust ventilation and maintain optimal cerebral blood flow. Understanding their location and function helps us appreciate how the body maintains homeostasis, especially in conditions where oxygen delivery is compromised or CO2 levels fluctuate. These small structures, although tiny, have a big impact on our respiratory and cerebral regulation. Now, let's take a closer look at how the control and regulation of ventilation and cerebral blood flow work. First, it's important to note that these chemoreceptors, particularly the carotid bodies, contain more chemoreceptors than the aortic bodies. This means they play a more prominent role in sensing changes in blood chemistry. When there's a need to adjust breathing or blood flow, impulses are sent over the glossopharyngeal nerve to the dorsal respiratory group, or DRG, which helps regulate respiratory activity. It's also fascinating to consider how highly perfused these areas are. They receive about 20 times their own weight in blood each minute. This high blood flow allows them to quickly detect changes in oxygen, carbon dioxide, and pH levels in the blood. The carotid bodies, as peripheral chemoreceptors, are crucial in this process. When they sense a change, they send impulses over the vagus nerve to signal the brain to adjust ventilation accordingly. Similarly, the aortic bodies, which are also peripheral chemoreceptors, contribute to this regulation by relaying information about blood chemistry. Altogether, these chemoreceptors form a vital feedback system that helps maintain stable blood gases and cerebral blood flow, ensuring our brain gets the oxygen it needs to function optimally. This coordination highlights the intricate connection between blood chemistry, nervous system responses, and respiratory regulation, key themes that underpin overall cardiovascular and respiratory health. Today, I'll be explaining how the control and regulation of ventilation and cerebral blood flow work, specifically focusing on what peripheral chemoreceptors respond to. These chemoreceptors are crucial sensors located outside the brain that help regulate our breathing in response to changes in blood chemistry. Their most significant response occurs during hypoxemia, which is when oxygen levels in the blood drop below normal, especially when the partial pressure of oxygen, or PaO2, falls below 60 mmHg. This triggers a strong ventilatory response, prompting us to breathe faster to increase oxygen intake. It's important to note that peripheral chemoreceptors play a relatively smaller role when it comes to responding to elevated carbon dioxide levels, or hypercapnia. They account for only about 20 to 30% of the ventilatory response in these situations. The majority of the response to high CO2 is managed centrally within the brain's respiratory centers. Another key point is how quickly the body reacts to changes in pH, or acidity levels. When blood becomes more acidic, say, during acidosis, the ventilatory response is about 5 times faster than that triggered by central chemoreceptors. This rapid response helps stabilize blood pH and maintain homeostasis. Connecting all these points, understanding how peripheral chemoreceptors respond to different blood gases and pH levels is essential for grasping how our respiratory system maintains balance and oxygen delivery, especially during various physiological stresses. Let's take a closer look at how ventilation responds to exercise and how it helps maintain homeostasis. During exercise, our body needs to produce more CO2 and consume more O2, sometimes up to 20 times more than at rest. This surge is significant, and our body has to adapt quickly to keep everything balanced. The key point here is that ventilation increases in tandem with these metabolic demands. When CO2 production goes up, our breathing rate and depth increase to match this, ensuring that pH, PCO2, and PO2 levels stay stable. This is crucial because maintaining these parameters within a narrow range is essential for proper cellular function and overall health. Additionally, as exercise intensity ramps up, cardiac output also increases, working in concert with ventilation. This synchronized response ensures that oxygen delivery and carbon dioxide removal are efficient, supporting our muscles and vital organs during strenuous activity. In essence, this mechanism demonstrates how our respiratory and circulatory systems are finely tuned to respond dynamically to physical stress, helping us sustain performance while maintaining internal balance. Let's talk about Cheyne-Stokes breathing, a pattern of breathing that we often see in patients with heart failure. This type of breathing impacts how the respiratory center responds to CO2 levels. An important point to remember is that changes in CO2 within the respiratory center actually lag behind changes in arterial CO2. So, when CO2 levels in the blood fluctuate, the brain's response isn't immediate, which can lead to these characteristic breathing patterns. This phenomenon is especially common in patients with congestive heart failure, or CHF. In these cases, the delays in blood transit time between the lungs and the brain contribute to the development of Cheyne-Stokes breathing. Basically, because the blood takes longer to circulate, the brain's response to CO2 changes is delayed, creating a sort of feedback loop. Now, the cause of Cheyne-Stokes breathing is linked to low cardiac output. That is, when the heart isn't pumping blood efficiently, leading to slower blood flow rates. This sluggish flow causes the delays we've discussed. So, what exactly is Cheyne-Stokes breathing? It's characterized by cycles where the breathing rate and volume gradually increase, then decrease again, eventually leading to periods of apnea or no breathing. The key feature here is this gradual crescendo and decrescendo in both rate and volume, which ultimately results in these pauses in breathing. In summary, it's this cyclical pattern of breathing with these smooth increases and decreases, culminating in brief stops, that defines Cheyne-Stokes breathing. Recognizing this pattern can be crucial, especially in patients with heart failure, as it reflects the underlying circulatory and respiratory interplay. Let's talk about how control and regulation of ventilation influence cerebral blood flow. CO2, or carbon dioxide, plays a crucial role in this process. When CO2 levels increase in the blood, it causes the cerebral vessels to dilate, which leads to an increase in cerebral blood flow. This makes sense because dilated vessels allow more blood to reach the brain tissue, helping meet its metabolic demands. Conversely, when CO2 levels decrease, the cerebral vessels constrict, resulting in a reduction in cerebral blood flow. Essentially, CO2 acts as a powerful regulator. Higher levels promote more blood flow, while lower levels reduce it. This dynamic is vital for maintaining proper brain function, especially during changes in ventilation or metabolic activity. So, understanding how CO2 influences cerebral vessels helps us appreciate how the brain tightly controls its blood supply based on its needs. Now, let's talk about how carbon dioxide, or CO2, influences cerebral blood flow. CO2 plays a really important role in regulating how blood flows to the brain. When CO2 levels in the blood increase, it causes the blood vessels in the brain to dilate or expand, which boosts blood flow. This vasodilation helps deliver more oxygen and nutrients to the brain when it's needed most. On the other hand, if CO2 levels decrease, the vessels constrict or become narrower, reducing blood flow. This mechanism is essential because it helps the brain maintain optimal function and oxygen delivery under different conditions. In medical settings, we closely monitor CO2 levels because they give us valuable insights into brain health and how well the brain is being perfused. So, in essence, CO2 acts as a key regulator, adjusting blood flow to meet the brain's needs and ensuring it functions smoothly. Traumatic brain injury, or TBI, is essentially a disruption in the normal functioning of the brain caused by a bump, blow, or jolt to the head, or even a penetrating injury. It can vary widely in severity, from something mild, like a brief change in mental status or consciousness, to severe cases where there's an extended period of unconsciousness or significant memory loss. Most commonly, TBIs happen due to falls, motor vehicle accidents, sports injuries, or acts of violence. The symptoms can be quite varied too. Headaches, confusion, dizziness, memory problems, mood changes, and difficulty concentrating are all common signs. Treatment really depends on how severe the injury is. It might involve rest and medications, but in more serious cases, rehabilitation therapies or even surgery could be necessary. Now, understanding TBI is important because it ties into our broader theme of how the brain is affected by injuries and how we can control and regulate cerebral blood flow and ventilation to support recovery and brain health. Let's talk about how control and regulation of ventilation and cerebral blood flow are critical, especially in the context of traumatic brain injury. When someone has a high intracranial pressure, or ICP, it can significantly impact brain health. One of the key concerns is cerebral hypoxia, which occurs when increasing ICP starts to cut off blood supply to the brain. This lack of oxygen can cause severe and often irreversible brain damage if not managed promptly. A critical point to remember is the threshold of ICP at 20 mmHg. When ICP reaches or exceeds this level, the brain is at significant risk for ischemia, which is basically insufficient blood flow. Normally, ICP is less than 10 mmHg, so once it surpasses 20 mmHg, active treatment becomes essential to bring it back down and protect the brain. Additionally, it's important to recognize just how demanding the brain is in terms of oxygen. The brain consumes about 20% of the body's resting oxygen, which underscores its high oxygen requirement. This is why maintaining proper cerebral blood flow and ICP levels is so vital to prevent hypoxia and safeguard brain function. All right, let's talk about the control and regulation of ventilation and cerebral blood flow, specifically focusing on carbon dioxide. When PaCO2, or arterial carbon dioxide pressure, decreases, it has a direct impact on cerebral blood flow. Essentially, as CO2 levels drop, blood flow to the brain also decreases. This is a crucial concept because managing PaCO2 is one of the key strategies we use to control intracranial pressure, or ICP. Now, to put it into perspective, for every 1 mmHg reduction in PaCO2, we see approximately a 3% decrease in cerebral blood flow. This relationship is significant because it highlights how sensitive the brain's blood supply is to changes in CO2 levels. Clinically, we often use mechanical hyperventilation to lower PaCO2, which in turn helps reduce ICP. But there's a catch: if we reduce PaCO2 too much, we risk decreasing cerebral blood flow excessively, leading to cerebral ischemia or inadequate blood supply to brain tissue. This underscores the delicate balance we must maintain. While lowering CO2 can be beneficial for ICP management, we must be cautious because overdoing it can compromise brain perfusion. So, in summary, managing PaCO2 is a powerful tool, but it requires careful adjustment to avoid potential harm from reduced cerebral blood flow.